Hello, friends. Today, I want to talk to you about the dangers of root canals and what does it really mean to have a root canal in this day and age. So, the first thing I want to start off with is that there are old root canals that have been discussed, and that's what you're reading about a lot of times. And they are very, very, very bad because a root canal is a dead tooth. And because technology wasn't as evolved as it is now, teeth just weren't cleaned out. And so they ended up leaving like a foci of infection, like a small little infection, which ended up causing like cancer and a lot of other issues in the body. So that was a huge, 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 huge concern. Now, fast forward 20, 30 years, and especially in a metropolitan city like San Francisco, where we have technology and we're able to really pinpoint these specific bacteria, and we're also specifically able to use lasers to disinfect them. And we have better technology, better materials, and biocompatible materials that can get rid of the infection and help you keep your tooth. And that is what I would recommend for you. Now, if you ever have a general dentist doing root canals, I would say no, no. I always recommend a endodontist who has a laser to disinfect the root canal. And I also always recommend that they use microscopes in order to make sure that they get the entire area clean. Now, you can also have an endodontist who uses ozone therapy to make sure that everything is nice and clean, or calcium hydroxide, which actually cleans things out. And those are some recommendations that I would give in order to have a holistic root canal. Now, I do want you to keep your tooth. The main reason is now that the root of the tooth actually has something called the periodontal ligament. And now that periodontal ligament is very important because it also has some stem cells, and it also gives a notice to your bone to keep the bone there. And now our bones also have our bone marrow, right? Have stem cells in them. So we want to keep that bone marrow and we want to keep that bone for as long as possible. And that's the reason why we want to make sure that you are safe and making sure that there's no infection left in your body, but also do it in a way that minimizes risks and gives you maximum benefits.